Hello, welcome to my video. I'm Awais Ibrahim. I'm quickly going to go through the type of doctors with you, and broadly speaking they fall into the following categories: anesthetics, general practice, medicine, obstetrics, gynecology, ophthalmology, pediatrics, pathology, psychiatry, radiology and surgery. This is a very broad, is not specific enough, so I'm going to go, this video is going to be a quick introduction, and the other videos I got to go through each specific job such as pediatrics in more detail and talk about things such as wage, lifestyle, every factor that you have to take into consideration. Anesthetics basically deals with pain relief, and generally these type of doctors work with surgeries. You have to have a very good knowledge of physiology and pharmacology, so you can know the different types of anesthetics and how the body reacts to it, and physiology, so you can know the function of every organ and everything. You must have recitation skills, basically like how to breathe on top of the patient, and because sometimes you'll be dealing with patients in intensive care who are terminally ill, who have a lot of pain, and so you have to understand how to operate in emergency situations. General practice is the doctor of the general practice. This is the real doctor, the jack of all trades. You have to have a complete and extensive knowledge of medical conditions, a variety of medical conditions. You have to know how to deal with the pregnant woman, how to deal with the man with cancer, how to deal with all different types of diseases and specialities. You have to know a bit of everything. Basically, you have to be jack of all trades. Since this is going to be the first line of defense, this is going to be the first point of contact for most patients. So if a country has good general practice, it's going to save them a lot of money because they're less likely to end up in the hospital. So general practice is very important. So also you have to know when to seek help. For example, if you're not able to deal with this problem, you have to know, okay, go to a specialist. Medical specialists, also it's relationship based. So since the patient must feel comfortable with you, so he can come before the situation gets worse. So say if he has like some sort of disease or abnormality or a problem, he can come to you first before the problem gets worse and he goes to hospital, and then he wastes more money. So you must have good relationship with your community. You have to have understanding. The general practice I'm referring to right now, you have to have understanding of your culture, your social, your community and your surroundings. Medical specialities. Basically, medical specialties cover a wide range of conditions, and for which people are admitted to hospitals. Basically, it talks about from respiratory to allergies to clinical genetics. Basically, it's more focused on one speciality. You have to study one speciality very deeply, extremely deeply. So this basically covers most of the jobs in the medical field, basically, if you think about it. So we will not leave this here. We'll do this more detail in another video. We go through every speciality, one video for everything here. Obstetrics and gynecology. Basically, it's obstetrics and gynecology you just deal with the pregnant woman. Obstetrics means you deal with the pregnant woman, and gynecology the study of the reproductive area. Basically, they use interchangeably. They generally mean the same thing. It means dealing with the pregnant woman. You must not be judgmental. You must be understanding of other cultures and the way they give birth and things like that. Ophthalmology, you have to have, basically this is a medical, and ophthalmology is the medical and surgical management of the conditions of the eye and its surroundings. So it's basically the study of the eye and its surroundings. Sometimes it's surgery, sometimes it's not surgery. So although this speciality, every speciality we have mentioned has lots of like another 10 or 20 sub-specialities. So we have to do it in more detail. Pediatrics is the study of helping children, basically treating children. So you have to consider one thing, that children are growing up, so their body is very different to the body of the adult. Physiology, they're going through lots of different hormones and things like that, so the body of the adult and children are different. You have to consider that. Also, you have to consider the legality. The child cannot take his own decisions, so a lot of times you have to take the parents into consideration. So you have to treat the whole family sometimes. So if the child has a disease, you must make sure the mother is calm and things like that. Pathology is a dissection of disease through a variety of techniques. You detect disease through a variety of techniques, and this job is more biology based, unlike other jobs. It's very scientific and more science based job, biology based job. You have to study cells more. As you can see, you spend a lot of time at the microscope. Psychiatry, you deal with patients with mental health. You have to have high quality clinical skills, and you remember you will have little help from any modern technology. So the whole job is based on you and your personality. In this job, your personality is very important, and you have to be positive and try to make the patient feel that you have to give the patient hope sometimes, basically. That itself is sometimes as important as the treatment you're giving him. Radiologists specialize in detection of disease through a variety of investigative techniques. This is more X-ray focused, basically. You focus more on X-rays, and unlike pathology where it is more biology focused, this one X-rays, and you have to have a very good understanding of physics. Surgery is basically ripping the patients up into, basically cutting the patients up and removing the organs and things like that. We've got to study that in more detail. It's not just ripping the patients up. We've got to study in more detail. So to get more videos like this, please subscribe to my YouTube channel, like my Facebook page. You'll see similar videos. So we do another. We got in the future. We'll do a lot of videos talking about in more detail, pediatrics in more detail, pathology in more detail, everything in more detail. And the things we're going to talk about are the effect of technology on this job. Will this job exist in 10 years time? Things like salary, lifestyle, demand of the job, and what skills you need, the type of person you need to be, things like that, more detail. Please subscribe to my channel, like and share my video, and give my video to every person who's interested in medicine, please.